Hello, my name is Dr. Anthony Santoro, and this video is titled Fundamentals of Neuropsychological Testing. And in this seminar, I will cover some practical skills of testing administration and scoring. And it's really most appropriate for someone who is just starting to learn about neuropsychological testing as part of their supervised clinical training, or testing technicians who are either administering neuropsychological tests for clinical use or as part of a research study. So to give a brief overview of what I'll be presenting, I'll give a brief introduction to neuropsychological testing. We'll review some special considerations that are unique to neuropsychological tests. We'll go over some general rules of good practice, and then I'll share some tips and tricks that I picked up along the way. So what is neuropsychological testing? So neuropsych testing refers to the process of assessing a person's neurocognitive functioning. It involves an examiner who is usually a neuropsychologist, or it could be a testing technician. And the testing tech or neuropsychologist administers a collection of performance-based tests to an examinee who is either a patient or a participant in a research study. So the examiner administers tasks, records performance, and usually scores afterwards, scores the performance. The examinee performs the tasks and responds to task items. And neuropsychological testing is used to identify an examinee's strengths and weaknesses. And this is to inform diagnosis, for example, of neurocognitive disorders such as dementia, as well as neurodevelopmental disorders such as ADHD or learning disabilities, and also to assess changes in cognitive functioning, either due to a medical illness or a traumatic brain injury. Neuropsychological testing also informs treatment and recommendations such as school and workplace accommodations for people with specific weaknesses. So what are neuropsychological tests? So neuropsych tests are performance-based tasks that measure specific neurocognitive abilities. And so some common abilities that we measure are verbal abilities, such as naming or fluency, visuospatial abilities, attention concentration, processing speed, so the speed at which we process visual information, motor abilities, learning and memory, executive functioning, so planning, organizing, problem solving. A neuropsychological evaluation usually involves assessing psychological and emotional functioning, and sometimes social and adaptive functioning as well. And so a testing battery, battery is a term that's used to refer to a collection of tests that are administered together. So once we collect the tests that we're going to administer, we put them together, and that's our battery. And some common tasks involved in neuropsychological tests include asking participants or patients to define words, identify associations or relationships, such as describing how two things or items are alike or similar, learning lists of words over multiple trials, repeating spans of numbers, choosing the correct piece or design to complete a picture, puzzle, or pattern, and performing simple tasks as fast as you can, which would be a measure of processing speed. So moving on to special considerations unique to neuropsychological tests. So the first consideration is the examiner participation. So the examinee and the examiner work together. And this requires active participation from the examiner. So it's a little different than just reading a survey question and recording the person's response. The examiner is usually responsible for handling the materials, and this can be administration manuals, stimulus books, record forms, response forms, stopwatches, blocks, etc. All of the various materials needed to administer a neuropsych test. The examiner provides instructions and demonstration items. They administer either by reading or presenting items. They keep time on time tasks. They record the performance and the participants' responses, and they prompt and query. And so there are some tests that require a prompt, which would be a verbal prompt. Do you have an answer yet? If the examinee hasn't responded within a specified time, so say 20 seconds. A query is when the examiner has to ask the examinee for additional details that are needed for scoring purposes when they respond without those details. The examiner is also responsible for discontinuing the task at the appropriate point. And this is usually after a certain amount of incorrect items, so say 3 consecutive incorrect items, or after a certain time, so 45 seconds. Sometimes this requires in-the-moment scoring. I'm thinking of some of the vocabulary tests in which you can receive a perfect score, a partial credit, or no credit. And discontinuing that means that the examinee has to have a certain amount of incorrect responses. And so judging whether something is incorrect or receives partial credit can be a little tricky and requires in-the-moment scoring so that we can discontinue at the appropriate point. The second consideration is the standardized administration of most neuropsychological tests. So standardized administration refers to standard rules and directions for administering a particular test. And this ensures that there is similar administration procedures across examiners. So it doesn't matter who gives the test, it's given in a similar way. And this is important, and adhering to the standard administration rules and directions are important for comparing performance across time as well as with others. And so this requires that the examiner reads instructions and items verbatim so that they do not change or add any words. And this kind of seems counterintuitive sometimes, especially there are some instructions or items that aren't written the most clearly. However, it's better to read exactly as it's written, exactly what's been read to every other examinee that has been administered this test, than to change the instructions or item wording in any way. Standard administration also requires that a test or a subtest be completed in one sitting, because that is how these tests were developed and normed. And so we want to avoid any breaks or chit-chats in the middle of a task. This can be hard sometimes when we have a chatty examinee who has lots of questions. And if an examinee does ask questions in the middle of a subtest, it's always best to defer till the end of that subtest, right? And say, okay, we could get to that as soon as we're finished with this. Standard administration also asks examiners to maintain a neutral presentation. And by neutral, I still mean friendly. So that's in our face and our body language. As I was saying, some subtests require in the moment scoring, right? And so if we're confused with whether an item is a zero, a score of zero, or receives partial credit, right? And we're thinking about it, maybe we'll have a concerned face, right? And the participant could experience that as they're doing poorly, right? Or if we say good job after each one, even though the examinee is responding incorrectly, right? That's really undue encouragement and discouragement. And the participant feeling either encouraged or discouraged could impact their performance. So we want to avoid any non-standard encouragement or discouragement, meaning just keeping a neutral but friendly face, keeping relaxed body language. Our third consideration are the start and end points. So the starting point, which is usually an item, vary. So you don't always start on question or item one, right? And so the starting point varies from test to test. It could also vary within the same test for the same test based on the age of the examinee. An example would be WASI matrix reasoning subtest. For 8-year-olds, they start at item 1. If the examinee is between 9 and 11 years old, they start at item 5. If it's 12 or more years old, if the examinee is 12 or more years old, you start at item 7. So starting points vary even within the same test sometimes. There are also things called reverse rules. And these come into play if an examinee answers incorrectly to the first administered items. So for some tests, if you start, say, on item 7, if the examinee gets item 7 correct, you would start administering items in the reverse order, so 6, 5, 4, and usually until the examinee responds to a specified number, either 2 or 3 items correctly, and then you would resume forward administration. So this can be a little tricky. There are also discontinue rules. And so discontinue rules tell us when to discontinue or stop administering a test. And these also vary from test to test. Although it's usually after a certain number of consecutive incorrect items. So scores of 0 on 3 consecutive items, say. However, discontinue rules can be tricky. For instance, there are some tests where the discontinue rule is 4 scores of 0 within 5 items, or scores of 0 on the last 4 items on a page. And so it's really important that we familiarize ourselves with discontinue rules and that we're comfortable with them before we even attempt to administer any neuropsych test. Our fourth consideration has to do with test protocols. So the protocol refers to the record form. So the protocol is a record of the examinee's performance. This is important. Anyone should be able to look at a protocol and be able to score it, not just the person who administered the test, so not just the examiner. And on the protocol, we record responses, right? Not just whether the person responded correctly or incorrectly. I also take notes on the protocol, right? And so it's important in preparing to administer neuropsych tests that we've developed a form of note-taking that is easily understood by anyone, right? And again, that's so that anyone who looks at that protocol is able to score it correctly. It is also important that we document errors, both errors made by the examinee and the examiner. And we all make errors, whether that's we accidentally circle a response that is an error, or we make an error when we're calculating a total score, or we score something correct when it was actually incorrect, We all make errors, and it's really important that we know how to document this on the protocol. And we can do this very simply. If an examiner does make an error, they simply should cross it out with a single line and initial it. And this allows anyone who reviews the protocol to understand what happened, right? Oh, this is the examiner's error. And so here is an example protocol of a test. It is based off of the WASI matrix reasoning. However, I have created these items to protect test security. So these are not the actual items or the actual correct or incorrect responses. And so first, let's read the instructions. It says, administer demonstration items A and B. Proceed with item 1, 8 to 11 years old, items 7 and 8 for 12 years old or older. If either 7 or 8, if either item 7 or 8 for 12 plus years old is incorrect, administer items 6 through 1 in reverse order until the examinee obtains perfect scores on 2 consecutive items. Discontinue items, credit items 1 through 6 if not administered. Discontinue after 4 consecutive zeros or 4 scores of 0 on 5 consecutive items. And so I want to really impress that this is not, these instructions are not more complicated than most neuropsych tests. These are standard instructions. And so if you're feeling a little confused, that's absolutely normal. We are all, everyone I think is a little confused the first time they read any neuropsych test instruction. And it's really important, and that's why it's very important that we take the time to really understand the rules before we attempt to administer. And so, administer demonstration items A and B. So we go to item A, we administer the item, we circle the response, and here on the protocol, the correct response is bolded. So the examinee responds, chooses response 4, that's correct, and so we circle that. We then administer demonstration item B. They also respond correctly, and you'll notice that that for answering the demonstration items correctly, examinees do not receive any credit, right? That's just so demonstration items are the opportunity for examinees to practice and get a feel for the test before we jump right in. So this examinee is 21 years old, so over 12 years old, and so we proceed to item 7 and 8. And so we start at item 7. The examinee responds correctly, and we score that correctly. We then administer item 8, and the examinee responds incorrectly. So remember, in the rules it says if either item 7 or 8 is incorrect, we administer items 6 through 1 in reverse order until the examinee obtains 2 perfect consecutive items. Okay, 2 perfect scores on 2 consecutive items. And so from item 8, we would then go to item 6. We administer item 6. The examinee responds correctly. We then administer item 5. The examinee responds correctly. So that's 2 consecutive perfect scores. And so we have met that rule. We draw a line to indicate that we've met the base. We then proceed in forward administration at item 9. We administer item 9 and that's correct. Item 10, correct. Item 11, correct. Item 12, correct. 13, correct. We administer item 14 and the examinee responds incorrectly. We administer item 15, another incorrect response. We administer item 16 and the examinee responds correctly, 17 incorrectly, 18 incorrectly. And so remember, we discontinued the subtest after 4 consecutive scores of 0 or 4 scores of 0 on 5 consecutive items. And here, within 5 items, we have 4 zeros, and so we have met the discontinue rule. So we would stop administering this test. We draw a line or a slash to indicate that we've met the discontinue rule. Now, when we're scoring this, we want to remember to credit items 1 through 6 if not administered. So items 1 through 4 were not administered, so we have to credit those items. And then we would count up all of the correct responses and get a total score. Here, 13. So moving on to general good practices of administration and scoring. So the first good practice is to review test manuals. And this is important both when you first learn a new test, as well as every few months after that. We all, especially when we're administering multiple tests, the rules of a specific test can get fuzzy after some time. And it's normal that we start to deviate from the standard administration over time. That's why it's important that we review test manuals not only when we're first learning the test, but every few months after. It'll help us maintain standard administration. A second good practice would be to treat the protocol, so the paper forms, as the official record of the participant's performance. This means taking notes on the protocol, and also we want to label all of the pages with the examinee's name and/or participant ID number. We also want to follow discontinue rules, and these can be very tricky. Although it's because they're so tricky, it can be tempting for an examiner to say, I'll just administer all the items, so I make sure that I've met the discontinue rules. And it's important that we don't do that. And the reason why is because it can be very frustrating and discouraging for an examinee to get 10 questions incorrectly responded to incorrectly in a row, right? And so we want to avoid examinee frustration and discouragement because this can impact their performance on the tests that come after a particular subtest. And so we really want to make sure that we're following discontinue rules. It's also important that we test until we have enough. So what I mean by that is not discontinuing prematurely. And so I suggest if you're unsure if an answer is correct or whether it receives partial credit, to always give the examinee the benefit of the doubt. And so what I do is if I'm unsure in the moment of whether a response receives no credit or partial credit, I will continue as if the item is correct, right? And so if the rules are to discontinue after 3 consecutive zeros, I would just make sure to get 3 consecutive 0 scores after that point. And so it's usually better to administer a few extra items than to discontinue prematurely, right? However, when we're scoring and we're calculating total scores, we want to make sure that even if we administer a few extra items that were unneeded because we go back and we realize the item that we were unsure about is actually an incorrect response, we only want to count the administered items before the discontinue rules are met. Count them towards the total score. Another good practice is to score the protocol and protocols as soon as possible after administration. And my mantra is an unscored protocol is an incomplete protocol. And I'll say that to myself, After a long day of testing and the patient or participant has gone home for the day and I'm still there scoring, that's my little mantra that I say to myself to push through. An unscored protocol is an incomplete protocol. Another good practice is to always double check your scoring. So counting correct items and calculating total scores at least twice. Um, we're all human and we all make mistakes. And we should always be double checking that we scored something correctly. Moving on to some tips and tricks. Tip 1, practice, practice, practice. So testing administration skills are skills. So nobody is born good at test administration. If you show me somebody who says they were born at test administration, I'll show you somebody who's never administered a neuropsych test. And so these skills come with practice and experience. And this is a little different, right, than administering a questionnaire, right, where all we have to do is read an item. These administration skills take some practice. I recommend the review, observe, try model whenever we're learning a new test. So first, I review the test materials. So that's the administration manuals, the stimulus books, the instructions, the items, any other materials, blocks, cards, grid boards. Then I ask to observe a supervisor administer the test. And I recommend that everyone do this. We all pick up new tips and tricks when we see somebody else give a test, even tests we're familiar with. After observing someone else administer it, I'll ask my supervisor to observe me administer it, right? And give me feedback. And then after that, I'll practice some more, practice, 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 right? And there are some tests that require a specified spacing between items, right? So say there are some tests that ask the examiner to read words, lists of words or numbers at 1 second apart. And so I'll practice administering items with a stopwatch, right? Just to get the pacing correct. Also, any test that has a time element to it, so for instance, for tests that require the examiner to present a stimulus card for a specified amount of time, say 5 seconds, I would practice with a stopwatch. For my second tip, be prepared. So we want to arrive early. The examiner wants to arrive early to set up and tidy up the testing room. Before the participant or patient arrives at the testing session, we also want to collect all of the forms that we'll need and all the materials that we'll need. We want to check our materials. We want to check that our stopwatch has batteries. We also want to make sure that our materials are available. So for offices that have multiple people who are testing and only one testing kit for a particular test, we want to make sure that that kit's not being used by someone else. Before the testing session even begins, I like to organize my forms in the order of administration so that I'm not fumbling around looking for forms, what to administer next. Also, if you know how old the examinee is, go through the protocols and circle or mark the starting point for so the starting item on each test, right? This will save time in referencing the instructions. Overall, it's important to have a plan for the testing session. And so I make a little checklist to help keep me on task, and I recommend that you do the same. It has all of the tests that I want to administer, and then I'll check. I'll give one check after it's been administered, and then later on, after the examinee leaves, I'll do give a second check once it's been scored. And really, it's important to have a plan for the testing session. And when you're planning your time and the testing session, to leave time for scoring at the end. So plan in that time for scoring. Tip 3, Build and maintain rapport. So rapport here refers to an effective, positive working relationship between the examiner and the examinee. To establish rapport, here are some tips. Be polite, kind, and professional, both in your language and your appearance. Greet the examinees when they first come to the office, and introduce yourself. Hi, I'm Dr. Santoro. You can call me Dr. S. I'll be working with you today. Make polite chit chat, right? So ask about their trip getting into the office. How is getting here today for you? Did you travel far? Tell them where the bathroom is and where they can keep their belongings. For instance, if it's in the winter months and they have coats, where can they hang up their coats? And give them a few seconds, or a few minutes to settle if they want to use the restroom. Also, you want to explain what they will be doing and about how long it will take. And at the very beginning, you want to elicit and answer questions. So ask them if they have any questions after you've explained the day, and answer them fully. And it's very important, especially in the beginning of the day, that we're paying attention to the tone of our voice and our body language. Because we don't want to come off as overly intimidating or stern. I had a fantastic supervisor once who did a lot of children work, so testing with children. And the more nervous a child was at the beginning of the day, while introducing the child to the tasks, the more relaxed her body language was. So just keep in mind your body language. If someone's very nervous in front of you, sitting up very straight with a stern face really doesn't help them become less nervous, right? So if someone's really nervous, just even a little bit more of a casual body position, right? And just a smile can really help ease that nervousness. So in my experience, examinees' nervousness subsides, right? So it really eases when two things happen. When they realize that the examiner is friendly, right? That you're not going to be mean to them. And when the examinee understands what they're going to be asked to do. And so at the beginning of the testing session, it's very important before we even administer any particular test that we've really put a good effort forth in doing these two things. After we've established rapport, it's important that we maintain rapport. And so how do we do that? Consider the examinee and their experience of being tested and let them know, right? Check in with them. How's it going? You're doing okay? Check in, give breaks, right? Work collaboratively. So another tip is to take notes, right? And so when we're using paper forms, we want to take notes in the margins. We want to mark starting items and when discontinue rules are met. Again, anyone should be able to score the protocol, not just the examiner. If we're using a tablet or an application-based administration, and this is becoming much more common, where we're not using paper forms anymore. We might be administering tests onto tablets. Make sure that you have a side piece of paper that you can take notes on. Okay, and I even do this. I even have my side piece of paper for notes, even when I'm using paper forms. So always make sure that you have some way of taking notes when you sit down to administer any type of test. So here's a great example from a protocol of one of our studies. So this testing tech noted that the child is blind, right on the protocol. So now whenever anybody is looking at this protocol and we see that all of the visual tests, right, have slashes through them, right, we understand that it's not that the test was not administered, it's that, or not administered for because it was forgotten or left out, right? This note gives us the reason why for discrepancies in the protocol, right? It's informative. Tip 5, mark up your protocols. So here is an example of a test that I put together based on symbol search. And so symbol search is a measure of processing speed. And so the examinee is asked to detect whether the two target symbols on the left, so here, match any of the symbols in an array of 5 symbols presented, right? And so I've changed it from symbols to letters to keep the test security, okay? And so here we're being asked if A or B is included in this grouping of these 5 letters. If yes, then we would check yes. If no, we would score no. So A or B is not here, so the examinee correctly drew a line through the no box. A is here, and so the examinee correctly drew a line through the yes box. B is here, and so on. And so now look at the last one answered. And so I should say that this test is discontinued after a certain amount of time, right? And so it's expected that the examinee will not get through all of the items, right? And so we have to discontinue the task while they're still working, usually. And so now look at this last one here. What is that now? Is that that the person was answering, the third to last one, and that their pencil extended to the next line? Is that a response? Is that a markup? Is this when the test ends? Is it that they've skipped that item? What I'm trying to show is that there are lots of questions if we just leave the protocol like that. Now look here. If we just draw a line, a simple slash, right, and we put the note after time's up, this really clarifies what's going on. This really documents the person's performance, right? This is that here, when they answered after this item, we said, okay, time's up, pencil's down, and then they just continued for a little bit, right? And that this is where the task was discontinued, right? Anybody who's looking at this protocol understands what happens. This is a record of the person's performance. Tip 6, so double check and document errors. And so here you see that I've put little X's next to items that were responded to incorrectly. So I've documented the examinee's errors. But now look here, I've put that there are 3 incorrect items on this page. In fact, there are only 2, so I've made an error. And so I want to document that. And I do that by drawing a line through the error, initialing it. I usually put error when I make an error, circling it, and then circling the correct response. And just like that, everyone understands who's looking at this protocol that I made a counting error and that I've double checked and that I've corrected it. And documenting your errors really gives whoever's looking at the document confidence that the original person who's scoring the document has double checked their work. Tip 7, show your math. And so for symbol search, the total score is the number of correct items minus the number of incorrect items. So it requires us to do math. And so any total score that requires calculations, I'll show my math and write out my calculations right on the protocol. And so 8 minus 2 is 6. Total score is 6, and I'll circle my total score. Tip 8, score as soon as possible. So you really want to score the protocols as soon as possible after administration as you can. And this is because the sooner after administration is the best and freshest that administration will be in our minds. And if not immediately after administration, we definitely want to make sure that we're scoring before we leave the office for the day. And I promise that scoring in this way and not putting off scoring for another day makes scoring quicker, and it also reduces errors, right? There are all times where we feel a little rushed or something happens that distracts us for a minute, and we don't fully complete the protocol, right? And we make a little mental note, or I make a physical note, oh, go back and fill this in. This was the answer, right? And so when that happens, if it's the next day or the next few days, it's harder for us to remember that, right? And so really, we want to score as soon after administration as possible. That said, we want to avoid scoring in front of a patient or participant. Our attention really should be on the patient or the participant um, when they're in the room. And we shouldn't be calculating total scores, right? If that's not necessary for the administration. And remember, a good mantra is an unscored protocol is an incomplete protocol. So tip 9, seek feedback. So ask a team member and ask supervisors to observe you administer tests. This really does help build your confidence in administration, right? Having someone who knows what they're doing and has been doing it for years see you and say, yes, that's the way that I do it. It really helps the examiner feel more confident in their abilities. Also, seek input from the team or your supervisors when you encounter tricky scoring situations, right? And so even experienced examiners seek input, right? There are some tests that are tricky to score, and it's always better to ask for input from the team. So my main takeaway points: neuropsychological test administration skills are skills, right? No one is born good at testing. It takes lots of practice. However, it does get easier with experience and practice. And even learning new tests gets easier with experience and practice. One, because you have a strategy for that, because of all of the other tests that you've learned. And two, you start to pick up similarities between tests, right? My second main takeaway point: practice, 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 right? You need to feel comfortable administering a test before you administer it to a patient or participant, 100%. And so you want to review your test manuals regularly, even if you're familiar with a certain test, right? You could always pick up little things by reviewing the materials. So administration requires the examiner's active participation, right? And so the examiner and the examinee work together, right? And the examiner's work continues after the examinee leaves, right? So my day's not done when the testing is done, right? Then I have to score. Also, treat paper protocols as the official record of the examinee's performance, right? So take notes, mark up protocols, document errors. And lastly, seek supervision and take advantage of your team. If you're unsure about a particular administration rule or a certain scoring of a certain item, it's always better to ask, right? And we all learn new things all of the time from each other. And asking, even if you're pretty sure but not 100% sure, getting that confirmation from a supervisor or a more experienced person of the team really does help build confidence. So thank you for listening. I hope that I was able to give you some tips and tricks for neuropsych test administration and scoring. Happy testing.